Hello, I am Marwan Aburas. I put courses on continuing education in endodontics. Almost every time after I present the course, I get so many questions. Questions such as, Dr. Aburas, what do you think about the mini axis, conservative axis? Why don't we use calcium hydroxide as intracanal medications? Why should I retreat an old root canal? The patient is asymptomatic, but the root canal is short. Why do we have to retreat it if we have to do a new crown? Questions like that made me wonder, what is the status of endodontics in the kingdom? Therefore, I have gone into the literature extensively. I was very impressed. And therefore, I have put together a short presentation about the status of endodontics in KSA. A closer look. Let's go.
Okay, let me go through some of these questions. For example, here's a root canal treatment, very old treatment for years. You can see it's short. Okay, the question, why retreat asymptomatic short fill? Another question, a lot of questions about calcium hydroxide as intracanal medication. You have so many materials. I don't use the material. I have never used it as intracanal medication. Or another question about sodium hypochlorite. And you know about the accidents, the incidents about this, what happens when you inject sodium hypochlorite during irrigation of a root canal. The problem is not this. The problem is not concentration, 2.5 or 5%. It's basically Clorox. The problem is this hand here injecting. The problem are these needles where you have on these syringes. The problem is called apical periodontitis. Our disease in endodontics is apical periodontitis. I'm going to call it AP. It's a bad disease. It's basically lesions in bone caused by necrosis of the pulp. The incidence of this AP is 3 to 5% when you have a necrotic pulp. No endodontic treatment. However, sadly, when you have root canal treatment, substandard endodontics, not a good endo, technical endo, the percentage of incidence of this disease is 20 to 60%. This is unacceptable. So my job is to focus on the kingdom. What is the incidence of this problem in the kingdom, KSA? I found it to be between 30 to 53%. And does it also occur when you have a good root canal? Yes. Sometimes we have a good root canal treatment, standard endodontics, and we have a problem. We have AP right here. The problem then is not endo. The problem could be cracks, could be other things. And the percentage of that is 7 to 14%. Therefore, we have to go in detail and look, a closer look at AP and endodontics in the kingdom. So what I'm going to show you now, I'm not going to read those slides. I'm going to go through them quickly. But I'm extremely impressed with the research that has already performed in the kingdom. The yellow is going to mention the authors and the school or the university. And over here, you're going to have where it's published. And I'm going to basically focus on the percentages. At University of Taiba, in Medina al-Munawwara, the incidence found from patients coming to the school to be 53%. We're going to also talk about adequate root canal or inadequate, substandard or good or standard endodontics. The adequate was 32%, inadequate 39%. At the same university, they surveyed practicing dentists in Medina, 70 of them, and they found that only 3% use rubber dam. Measurements with X-ray, about 60%, rotary instrument 37%, etc. At the same university also, they evaluated the quality of root canal treatment performed in the undergraduate students. Very interestingly, it was acceptable, 68%. But the problem was in the unacceptable, 31%. And they found the errors, underfill, overfill, voids, fractured instrument, etc. So this kind of assessment is very important to know about the quality of education and the areas of weakness that you should focus on. At the same university, at Taiba University, perhaps another department, these authors here investigated 100 cases that has endodontically treated teeth, ETT. Interestingly, they found the percentage of AP not 53, 74%. Success was only 20%. These numbers are bad. This is not good. When we see our patients coming like this, these patients may have been treated previously. But that gives you an idea about the quality of oral treatments, oral health care in the kingdom, the kind of quality dentistry that you find. Here we have in Riyadh College, Dr. Matthew did a survey of 150 GP and endodontists. And the results was incredible. His conclusion, he said, based on the results of our study, it can be concluded that most of the GP and practitioners and specialists apply methods not accepted in contemporary endodontic profession. They are still following some standards that is substandards. In another study surveyed about 26,000 teeth, again, they confirmed the same issue. Only 42% of male and 57% of female teeth had adequate root canal. That means 60% were not adequate. And that's the issue. That's the issue we are trying to focus on. At the University of Qasim University, couple very good studies again. They evaluated the root canal with post, whether it's prefabricated post or cast post, etc. Again, the acceptable root canal treatment, acceptable RCT, look at this, 8%. That's very low for a quality of root canal treatment. And with that, you will find AP. Another study at the Qasim University, in which basically they evaluated the prevalence of AP, 22%. The adequate root canal here is 69%, the adequate is 31%. In healthcare, we should be talking about 90% adequate. We should be talking about 100% acceptable. This is another interesting study at the University of Ha'il. Here they evaluated the failure of endodontic treatment. 200 teeth, they found that, imagine this, the percentage of failure or maxillary anterior, which is supposed to be simple, straightforward, 14%. Premolars, 20%. Molars, 31%. Again, this is not acceptable. These patients came to these clinics. Perhaps these treatments were performed previously. At the National Guard, they did a survey. They surveyed radiographs, and the conclusion was, here again, the incidence of AP was 58%. They concluded 80% were poor root filling. And again, the conclusion, the quality of endodontic treatment, status with canal of corona restoration, the type of restorative material were found to be most important factors influencing the outcome of health. At King Saud University, combination studies, okay, This is extremely interesting that when you have the teacher evaluate the quality of their education themselves. Dr. Balto here, a few years ago, they did a study of acceptable undergraduate performance. They indicated that the acceptable was 23%. 23%, that means you have more than 60% unacceptable. And they found the problem were ledges, transportation, and apical perforations. At the Arab American University in Palestine, extremely interesting study was performed on using periapical radiographs and CBCT, 308 maxillary and 83 anteriors. Look at the percentages of acceptable treatment. Acceptable maxillary anterior, imagine that, was less than 10%. In the mandible, almost 11% acceptable. That means 90% unacceptable. You make you wonder. And therefore, a variety. Here is a situation from Farabi College. They found the acceptable was 32%. And they were mostly maxillary anteriors. They did not even mention posteriors. In terms of difficulty, why students have problems, well, why you have these results, again, from the evaluation, most of the problems you find in access preparation. Now, what does this mean to me? This to me means we need to have courses on access preparation, canal locations, etc. A very interesting study by Dr. Fouzan in the National Guard. This is a very comprehensive for all over the kingdom. They surveyed 400 GP throughout the country. And this is what they found. Only 3% of dentists use rubber dam. 55% use saline. That's not acceptable. They still use medications from the 19th century, formacrysol. They use a technique which is loaded with errors, step-back technique. We know that. And therefore, with these research have identified very valuable areas of the strengths and weaknesses that we should pay attention to. Now, when we talk about 50%, 60%, 70%, what is the natural incidence? If a person lost their pulp, if we have a pulp necrosis, what is the percentage of apical periodontitis should be? Here is a study told you that. Should be 4.5%. This is the normal prevalence. The normal prevalence of apical periodontitis should be between 3 to 5%. In endodontically treated teeth in this study, they find it 66%. In endodontically untreated teeth, 33%. Maybe there is other reasons and so forth. So these are valuable information that we use. Now, here we have a very important medical dental study. And that is the incidence of apical periodontitis in patients which are diabetic. The conclusion, periapical lesions are associated with poor glycemic control. So when you have AP, it's difficult to control diabetes. We found this conclusion before in periodontics. Now you could ask me now, what about international, global? The global study, okay, again showed that the incidence of AP in endodontically untreated teeth is 3%. Globally, surprising, 52%. So what's the conclusion? Endodontic education is on the decline. Endodontic education need repair. We need to go back to the basics. Thanks for listening.